Hello, welcome to Smart Move. Smart Move is a program where we bring to you the successes, challenges, program initiative of the Okowa-led administration, how well they've been able to drive their policies to achievable results. And on this program, Smart Move, which is segmented into three, we'll have our Smart News, bring information, happenings around the Okowa-led administration, successes, and of course, our MDA in Focus, where we talk to heads of ministries, departments, and agencies. Those are the hem of affairs, how well they've been able to drive the Okowa-led administration's vision, the SMART agenda. SMART is an acronym that stands for Strategic Wealth and Job Creation for All Deltans, Meaningful Peace Building, Agricultural Reforms and Accelerated Development, Relevant Health and Education Policy, and of course, Transforming the Environment through Urban Renewal. Our focus today is on health. Today we'll be talking with Dr. Ben Nkechika, the Director General of the Delta State Contributory Health Scheme. What's the scheme all about? Who are the beneficiaries of the scheme? How will Deltans benefit from the scheme? And how does this scheme translate to the SMART agenda of our governor, Dr. Arthur Okowa? These are questions that need to be answered on MDA in Focus. Our last segment is the SMART visit. We'll be joining the governor around the 25 local government areas in the state, interfacing with people, interfacing with Deltans, asking Deltans what they need, and of course, commissioning projects that has been done by this administration 2 years down the line. On this program, we'll bring to you everything you need to know about governance in Delta State. Please stay. I'll be right back.
In an economic downturn, it is time to look inward. There is a place in Nigeria with an abundance of investment opportunities. Welcome to Delta State. Tax haven to investors, guaranteed security, skilled and abundant workforce, macroeconomic stability, favored government policies, endowed with mineral and agricultural resources, access to market distribution channels, a place where humanity and opportunity collide, where energy and optimism abound and progress is the way of life. Invest in Delta State. Welcome to Delta State.
This is Smart News. On Smart News today, the Delta State government has signed a memorandum of understanding on oil palm production, plantation and processing in Akukwibo, Shimli North, a local government area, with Noteworthy Company Limited. Signing the MOU on behalf of the state government, the secretary to the state government, Right Honorable Festus Agas, who signed alongside with the Chief Executive Officer of Noteworthy Company Limited, Dr. Gabriel Ogbeche. In another development, starter packs have been presented to persons with disability who were trained under different skills like hairdressing, barbing, aluminium works under the Delta State Skill Training Entrepreneurship Program. Presenting the starter packs to those persons, the Chief Job Creation Officer, Professor Eric Ebo, said it was the magnanimity of the governor to include all in his prosperity agenda. The governor commended him for carrying everyone along in the skill training entrepreneurship program to all strata of persons in the state. And with that, it concludes the Smart News. I'll be back after the break. Hello and welcome back. This is Smart Move, an MDA in Focus it is, where we'll talk to heads of ministries, departments and agencies who will be speaking with on Smart Move. Join me as I make welcome the Director General of the Delta State Contributory Health Scheme, Dr. Ben Nkechika. Welcome to Smart Move. My pleasure. Good. You are the hem of affairs of this commission. The law establishing this commission, what are its functions and objectives, and how does it benefit Deltans?
The Delta State Contributory Health Commission is a commission empowered to implement the Delta State Contributory Health Scheme. The Delta State Contributory Health Scheme is a health financing model which basically takes out out-of-pocket payment and gives every resident of Delta State the opportunity to contribute over a period of time or within a short period towards their healthcare needs whenever they need it.
Okay, basically, this a Delta State Contributory Health Scheme. What's its coverage and areas of exception?
First of all, the scheme is mandatory for all residents of Delta State.
You being a Deltan or not?
Yes, once you are a resident of Delta State, you are entitled to be part of the scheme. And the reason why is when your neighbor is sick and you are well, then you are exposed. So the idea is to ensure that everybody has access to the healthcare needs and that every Deltan is resident in Delta State is healthy and not able to create a problem for others. Also, it covers all socioeconomic groups, but the scheme has been compartmentalized into 3 sections. The first consideration is the people that have been classified as vulnerable, those that for some reasons are not able to have economic impact to be able to contribute. They fall into the range of the pregnant women, children under 5 years of age, elderly above 65 years, mentally and physically challenged, and those that have been classified as poor and unable to pay. The next group of people are the people we call the formal sector groups. Those are the people that earn a salary. A percentage of the salary is provided by the employee, and a percentage is provided by the employer to support the employee. After that, you have the formal sector group. Those are the artisans, the market women, the Okada riders, and co. For those, a certain amount of money which has been actuarially determined. And then once they make that contribution, and they get access to healthcare. There's also the private health scheme, because the benefit package in the healthcare covers a significant amount of the disease burden within Delta State. Because in the health insurance scheme, it's very expensive and difficult to cover all ailments. So there's now a private health scheme in which if you desire extra health needs, let's give an instance, you want to go for heart surgery and kidney transplant and all that, you contribute extra to entitle you to the private health plan.
Just recently, the scheme was launched by the governor of the state. What do we expect as Deltans?
Yeah, the health scheme actually commenced 1st of January 2017. It started with the transitioning of the free maternal and child health care program into the health insurance scheme. The reason for that strategy was, first of all, to ensure continuity in the free maternal and child health care program, also give the pregnant women and the children under 5 a first start in the health insurance scheme because they have a significant impact on the health indices of the state. And also, the free maternal and child care program was operating in the secondary facilities, which are located in the townships. But when it was transitioned to the health insurance scheme, it started operation at the primary healthcare facilities where the actual rural people that need the free healthcare service are actually domiciled. What the governor has announced that in July, the formal sector group and the informal sector group will now come in and join the team. Because for a health insurance to be successful, you need to have a pool of healthy people and a pool of sick people. You need to have a pool of wealthy people and a pool of poor people. So it's that mix that makes the health insurance viable and sustainable. So what Deltans should expect is an improvement in the quality and access to healthcare in Delta State and a system that makes healthcare resources sustainable and creating impact. Also, the most significant expectation is the fact that the patient now is considered the customer, and the customer has rights now. Because when you make a contribution towards your healthcare, you can actually have that access and be able to follow up with the quality of care you're getting.
Since you came on board, what are programs on ground, and do you think Deltans are prepared for this?
Yes, we actually did what we call a baseline assessment as a prerequisite for starting up the health scheme. And we did a survey of Deltans, and we got a 67% enthusiasm on the health insurance scheme. We also did an assessment of the the current healthcare systems currently operating in Delta State. So the baseline survey was quite extensive. It also checked the quality capacity of the healthcare facilities in Delta State. And from the result, it's quite clear that Deltans are enthusiastic about it. They are waiting for it. They are willing for it. The apprehensions we noticed from our survey was they were very worried about the quality of care they are going to get, particularly from the government hospitals. So over this past 1 year, we've been improving the quality capacity of the government hospitals in terms of behavioral change, in terms of quality of drug, in terms of equipment, and in terms of capacity to create what we call best practice standards in healthcare delivery services. Also, another worry we got from the residents of Delta State was the cost. From an actuary study, a cost that would be adequate as a premium was determined, but the governor has graciously given a provision in which we have adjusted the cost to suit affordability of Deltans, because in our survey we actually checked what amount are Deltans willing to pay and contribute for health insurance scheme. So we have that figure, and we use that figure to adjust our premium. So the premium that is going to come up will definitely be very affordable to Deltans.
Okay, before I go to that premium and the analysis, basically, is there any partnership between the commission and more like a PPP, private partnership?
Well, yes, there are avenues for partnerships, but the avenue for partnership is more on the supply side, because in the health insurance program, there's a demand side in which the residents demand for healthcare, and then there's a supply side in which the healthcare facilities supply the health services. So on the supply side, yes, there are partnerships, because the scheme gives provision for both government and private hospitals. It also gives a provision for partnerships between a hospital, maybe a private clinic, and a laboratory. So it creates various partnership models. On the demand side, the partnership is more on the social mobilization, going out to the public to educate them, talk to them, encourage them with the benefits of the scheme for them to get involved. So yes, there are various partnership models, right, both private and public partnership models. Yeah.
Okay. I just got this message from Ife Inugeli, and it says, if everything goes as planned, how does it affect the economy of the state and its citizens?
First of all, the most significant impact is the fact that the healthcare resources will now be properly channeled in the right direction. The budget for healthcare will now be properly targeted at the areas of need of the residents. So previously, lots of hospitals were being built, equipments were provided, and the residents cannot afford it. So you go to a community, you see a very fine hospital, equipped and all that. But the residents living in those communities can't actually afford the healthcare services. So what this system creates is that it brings a bridge between the residents of a community and the healthcare facility. So it provides access. So there's now proper utilization of healthcare resources to the benefit of the residents of Delta State. Also, in terms of the capacity to sustain the project, the state has graciously approved 0.5% of the consolidated revenue fund to support the health insurance scheme, to make sure that those that cannot afford healthcare have access to healthcare. And also the government is actually creating a system where primary healthcare centers are upgraded to provide quality healthcare in terms of human resource capacity, in terms of equipment, in terms of process systems for ensuring best practice delivery. So on the overall, resources will be properly utilized. So you find out on a long-term basis, the cost of healthcare reduces, quality of healthcare improves, access to healthcare improves, and the well-being of Deltans get the best benefit of it.
Hospitals are credited for the scheme. Do we have them on ground, and what are measures put in to checkmate SSCs by these health workers?
Yes, one of the mandates of the Commission is to actually accredit healthcare facilities for this program. And we've started that. The government facilities in the secondary center healthcare level have been accredited. Primary healthcare accreditation is currently ongoing. Accreditation of private healthcare facilities is currently ongoing, and the set standards are there. We've used a minimum best practice standard to determine accreditation process, and not just accreditation, there'll be a quality improvement program in which the hospitals are graded over a period of time to improve their quality of healthcare. And we're already having partnerships from international reputable organizations to help us in that quality improvement process to ensure that we meet best practice standards.
There's a rumor in town that the state government, the co-led administration, has stopped the under 5 and free maternal health care. Is this true?
Well, I will say clearly that the free maternal and child healthcare program did not stop. Instead, the governor graciously set up a system to make it sustainable, to make it available to the people that really need the free healthcare service, which are people that live in the rural communities. So first of all, the government made a proper budgetary provision of 0.5% of the consolidated revenue fund of the state. It's there in the law to pay for healthcare services of all pregnant women, children under 5, and those that are vulnerable. Also, the governor mandated that the free maternal program, we should now start in the primary healthcare facilities where the real people that need it are residing. So the program is continuous, is ongoing. I can tell you that as at end of May 2017, we have 60,000 pregnant women and children under 5 registered, receiving treatment free of charge in hospitals in Delta State. And the statistics are there to prove that.
Just recently, in the news, we heard about the MOU signed by a commission and a company. Can you please throw more light on it?
Yeah, the MOU was signed between a French pharmaceutical company called Servier and the Delta State government. In our cost analysis, we've realized that one of the very significant issues in healthcare delivery is, one, the cost of drug and the quality. We know that recent statistics show that a large percentage of drugs in circulation in the country are not genuine. So we formed a partnership with Servier of France, where we source the drug directly from the manufacturing plant. So based on the fact that we have the source of the drug, we are rest assured of having quality drugs. Servier Group magnanimously has offered what we call a hospital cashback program, where they provide antihypertensive and diabetic drugs at a very significant discount to the Delta State government. Okay. And they will train close to 200 medical doctors, pharmacists, nurses on the current trend in management of diabetes and hypertension. And those on the drug, when you collect the drug, the discounted drug produced by Servier, once you scratch a card, you get enrolled into a scheme. And if you have any medical condition that puts you on admission beyond 2 days, they provide and pay for your medical bills for the admission. So it's a win-win situation for Delta State. It gives us access to quality drugs. It gives us access to better management skills for diabetes and hypertension, which is a huge disease burden in Delta State. It trains our doctors and nurses. It provides health insurance premium for the vulnerable people within the state. Now, Servier also has acquired a big manufacturing plant in Nigeria, the Swifa manufacturing plant, and they intend to manufacture generic drugs in country at very huge lowered cost, and those drugs will be made available to Deltans in the health insurance scheme. So on the general scale of it, Deltans will have access to quality drug, Deltans will have access to quality and affordable drugs with significant discounts, and the medical personnel will be trained on how to better manage hypertension and diabetes.
I got this message from a social media network, and it's from Vivian in Ogbompa. It says, what is in for the vulnerable and the retired personnel before this program kicks off?
Well, the law, first of all, prescribes that any resident of Delta State above the age of 65 is classified as vulnerable and will be the government to pay for their benefit. Those that have retired, if they have retired before the age of 65, they have the provision of either engaging from the informal sector, in which you pay on an individual basis your premium, or if they have an organization they've retired into, they have an employment process, and then a percentage of their contribution in that category suffices.
Is this scheme sustainable?
Yes, it is sustainable based on the strategic implementation we've put in place. A couple of things that are going to make it sustainable is, one, the quality of the healthcare service delivery. The second is the cost of providing the service. That's why we're going into partnerships to ensure that the cost of the medications we receive and dispense in the scheme are subsidized or come at very low cost. Also, the quality of the service human resource capacity is also being looked into. We've just launched a treatment protocol in which we provide a desktop in every primary healthcare center powered by solar, and that treatment protocol ensures that even if you come to the hospital and the doctor is not on ground, the nurse or the CHU there can actually go through the protocol and provide you basic healthcare service before the doctor arrives or come to a stage where he can actually refer you to a referral center for better care.
Data collection of all residents in Delta State. That should be a challenge. So just tell us a brief challenge and success you've actually achieved before since you came on board.
Yeah, like I said, we currently have over 60,000 pregnant women and children under 5 registered into the scheme. We've created a model in which there's going to be registration of Deltans across board. In each local government area, there are going to be registration centers. In Asaba, there are going to be registration centers. There are going to be an ICT system, an ICT platform that's going to go into the field, capture the data, capture the biometrics, ensure that the payment process is easy. You can pay through your POS, you can pay through the web page, you can go to the bank and make your payment. So all that strategy is in place to ensure that we have a good spread across all the local government. You can also walk to a primary health care center and register in every community. Right now, Delta State has over 400 primary health care centers scattered across the state. If we provide a system, you find that your ability to go register is just 30 minutes walk from everywhere. Both wards now have. So we've created a system to ensure that there's a spread and is ICT-based, backed up by a manual system to ensure that the continuity is in place.
Good. And on that note, I want to say thank you so much for coming on the program as Smart Move, being our guest today. And I know that Deltans will key into this great project, ensuring that relevant health is provided to all Deltans. The most important thing we need to do is that the state governor, Dr. Ifeanyi Arthur, has ensured that the smart agenda, which health is one of them, must be achieved basically, and that's why the Delta State Contributory Health Scheme was set up by the governor. I want to say thank you so much. My pleasure having you in our studio. I'll be back after the break. Please stay.
I'm really very excited that we have a good number of you who have come and looking through the hall. I'm convinced that you're carefully chosen to represent various segments of the society in really South. I have thought it necessary, along with members of government that haven't done 2 years in office, we need to go around to meet with our people, to brief them about what we're doing in government, and also let them know what our challenges are. But more importantly, to give them the opportunity to make their own contribution in governance, and also to create a room, a forum for them to ask questions, and we will, by God's grace, attempt to provide answers to your questions.
Mine is just an appeal on behalf of the women here present. We are seeking that you use a good office to grant the women more appointments in your cabinet.
We still have a lot of vast arable lands that will be cultivated with so many armor crops in Ughelli South. And we want to request that you establish some of your training centers in this area so that our youths, our women, our middle-aged class can also benefit from your smart agenda.
I wish to state in this consultation that all ghost workers be eliminated from the staff list of this state. They should be deleted immediately. We should use the resources in this state to pay those who are alive and working.
Sir, we need you to use your good office to add to our salary.
Some time ago, we approached the Excellency on microcredit, and you recommended us to the office of the microcredit section by your office there. We were told to submit all our documents since last year, October. Each time we go there, it's one story or the other. The thing has not been processed. It has not gone. At a point in time, I even tested. I was going to report back to the governor. But you signed for 19 microcredit for us. So you may be thinking that they have attended to us. But we want to report to you now. You know what we're preaching this? We don't have any other governor coming 2019. You are the governor we know.
Hope you had a nice time watching Smart Move. Remember, to be part of this program, you can join us on our social media network, our Facebook account, Smart Move, our Twitter handle account, @Dschc Smart Move, and you can follow us on our Instagram, @Dschc Smart Move. Think smart, move smart. Bye for now.